Just yesterday, my neighbor passed away from a stroke. He was in his early 70s, retired, active, always walking his dog every morning. No major health issues, no warnings. His wife said he just sat down in his favorite chair and never got back up. By the time the ambulance arrived, it was too late. The scariest part? He showed signs the day before, slight confusion, slurred speech, but no one thought it was serious. Someone you love could be having a stroke right now, and you might not even realize it. A stroke doesn't always start with someone collapsing or losing consciousness. Sometimes it begins with a slurred sentence, a sideways glance, or something as subtle as an unusual headache. If you're over 60 or caring for someone who is, this could be life-saving information. Today, I'm going to show you the 6 most dangerous signs of stroke, the ones that are often missed in the first few minutes. But if you recognize them in time, you could save a life. Sudden numbness or weakness on one side. Let's start with one of the most well-known, but often misunderstood, signs of a stroke. Sudden numbness or weakness, especially on one side of the body. This kind of symptom typically comes on without warning and may affect the face, arm, or leg, sometimes all 3. Picture this. You're sitting at your kitchen table, holding your morning coffee. Suddenly your hand doesn't feel quite right. The mug slips from your grip and crashes to the floor. You try to say something to your spouse, but the words feel garbled or won't come out at all. You stand up to get help, and suddenly your right leg feels weak, heavy, almost like it's not part of your body anymore. This kind of episode can be frightening, and it should be. But too many people brush it off thinking they're just tired, dehydrated, or getting older. Maybe you've heard someone say, "I just slept funny on my arm," or "I'm sure it'll go away." Please don't make that mistake. Sudden weakness or numbness, especially when isolated to one side, is one of the most dangerous and immediate signs of a stroke. The American Stroke Association explains that this is usually caused by an ischemic stroke, the most common type, which happens when a blood clot blocks an artery supplying blood to the brain. That blockage deprives brain cells of oxygen, causing them to die rapidly. Your brain controls different sides of your body from different hemispheres. If the left side of your brain suffers a stroke, your right arm or leg may be affected, and vice versa. In some cases, facial muscles are also involved, causing one side of the face to droop. These effects are not gradual. They're sudden, and they are a medical emergency. Time is brain. For every minute a stroke goes untreated, nearly 2 million brain cells die. The longer you wait, the more severe the damage, and the lower the chances of recovery. What to do? If you experience sudden numbness or weakness in your face, arm, or leg, especially if it's just on one side, call 911 immediately. Don't try to drive yourself to the hospital. Emergency medical personnel can start life-saving treatment before you even arrive. Every second counts. If you're with someone who shows this symptom, ask them to smile, lift both arms, and speak. A simple sentence. If their smile is uneven, one arm drifts downward, or their speech is slurred, don't hesitate. Call for help right away. Recognizing this sign and acting quickly can be the difference between life and death, or between full recovery and permanent disability. You know your body better than anyone. When something feels off, don't ignore it. Trust your instincts and take action. Sudden confusion or trouble speaking. The second deadly sign of a stroke is sudden confusion, trouble speaking, or difficulty understanding what others are saying. This can happen without warning, and when it does, it can be deeply frightening. Imagine this. You're chatting on the phone with your daughter or a close friend. Everything's fine, until suddenly the words you want to say just won't come out. You know what you mean, but your mouth won't cooperate. Or maybe the other person is talking to you and it sounds like they're speaking another language. The words are there, but they don't make sense. Sometimes your speech might come out slurred, or you might repeat the same words over and over without realizing it. It can feel like your brain and mouth are no longer in sync. This isn't just a senior moment or mental fog. According to the Mayo Clinic, these symptoms are often signs of an ischemic stroke, a stroke caused by a blockage in the blood vessels leading to the brain. When blood flow is cut off to the areas responsible for language and comprehension, like the Broca's or Wernicke's areas, your ability to process and express language can be disrupted in seconds. Why this matters? This kind of symptom can be brief, just a few minutes, or it can quickly get worse. That's why it's so important not to ignore it. Many people wait thinking they're just tired, dehydrated, or having a stressful moment. But with a stroke, every minute counts. What to do? If you, or someone you're with, suddenly has trouble speaking, understanding, or seems confused for no clear reason, call 911 immediately. Don't try to drive yourself to the hospital. Emergency responders can begin life-saving care on the way. Don't chalk it up to aging or stress. You know yourself. When something feels off, trust your instincts. Getting help fast could mean the difference between recovery and lifelong disability. Sudden trouble, seeing in one or both eyes. Sign number 3 is one that people often overlook. Sudden trouble seeing in one or both eyes. This may come on as total blindness in one eye, blurry or distorted vision, or a sensation like a dark curtain falling across your field of sight. Let's say you're in your kitchen, pouring a glass of water, and suddenly, you can't see the edge of the counter. Or maybe you glance at the TV, and it looks like there are 2 images instead of 1. The room might look warped or shadowy, and your depth perception may be completely off. You might even bump into furniture that you normally navigate around with ease. This type of vision change can be unsettling, and for good reason. According to Harvard Health, strokes that affect the occipital lobe, the part of the brain at the back of your head that controls vision, can cause sudden visual disturbances. These types of strokes are less well known than ones that cause weakness or speech issues, but they are just as serious. In fact, vision loss caused by a stroke doesn't usually cause pain, which makes it easy to ignore or blame on fatigue, eye strain, or cataracts. But make no mistake, even temporary vision loss, even if it comes and goes, is a medical emergency. Why this matters? Ignoring these symptoms can lead to permanent vision loss or more widespread brain damage. The brain relies on blood flow for every function, including sight, and a delay in treatment can mean irreversible harm. What to do? If you or someone you know suddenly experiences vision problems, whether it's blurriness, double vision, or loss of sight in one eye, call 911 immediately. Don't wait to see if it gets better. Don't call your eye doctor. Don't take a nap. Your eyes may be the first to signal that something is wrong in your brain. Pay attention, act quickly, and protect your health by getting help the moment vision changes occur. 4. Sudden severe headache with no known cause. Now this one's especially important to pay attention to, because it can happen to anyone, even if you've never had a stroke before or any health issues at all. A sudden severe headache, often described as the worst headache of your life, can be a sign of a hemorrhagic stroke, which is caused by bleeding in the brain. Unlike the more common ischemic stroke, where a clot blocks blood flow, a hemorrhagic stroke happens when a blood vessel bursts, leading to bleeding inside or around the brain. This can cause brain swelling, pressure, and rapid damage, sometimes within minutes. It's tempting to lie down, take some aspirin, or wait it out, but that can be a deadly mistake. The Centers for Disease Control and Prevention, CDC, explains that hemorrhagic strokes account for about 13% of all strokes, but they're responsible for a much higher percentage of stroke deaths. That's because the bleeding puts intense pressure on the brain, and without fast treatment, brain tissue starts to die. These strokes often affect people with high blood pressure, aneurysms, or blood vessel malformations, but they can also happen without warning in someone who seems perfectly healthy. What to do? If you experience a sudden, unexplained headache that feels different from any you've had before, call 911 immediately. Do not take a nap. Do not assume it's just stress. This type of headache is your brain's cry for help. When in doubt, always get checked out. It's better to overreact and be safe than to hesitate and risk permanent damage or loss of life. Sudden dizziness, trouble walking, or loss of balance. Next up is a symptom that's often misunderstood, especially among seniors. Sudden dizziness, difficulty walking, or loss of balance and coordination. While these signs might seem mild or easy to dismiss, they can be an early warning of a very serious stroke. Imagine you're walking to the kitchen to get a glass of water. Everything seems fine. Then suddenly the floor feels like it's tilting. The room spins, your legs feel unsteady, and you have to grab the counter just to stay upright. Maybe your stomach flips, or you feel like you might faint. You might even fall, thinking it was just a clumsy moment or that you stood up too fast. But this isn't just fatigue or low blood sugar. It's a warning sign that your brain could be in trouble. According to Johns Hopkins medicine, these symptoms can signal a stroke in the cerebellum, the part of the brain responsible for balance, coordination, and posture. Cerebellar strokes are often harder to recognize because they may not affect speech or cause facial drooping right away, but that makes them no less dangerous. In fact, because they're harder to spot, treatment is often delayed, which can lead to more severe outcomes. Some people may also experience nausea, vomiting, or a feeling of being disoriented. These symptoms can come on quickly, and without other classic stroke signs, it's easy to chalk them up to other causes. Falls are already a major risk for older adults, and if a stroke is causing the imbalance, the danger multiplies. Listen to your body. Sudden dizziness isn't something to ignore. Taking quick action can mean the difference between a short hospital stay and a long road to recovery, or worse. Trust your instincts. Get checked. Face drooping or uneven smile. Finally, let's talk about a stroke symptom you can actually see in the mirror. Facial drooping. This one is often subtle, but it's one of the most recognizable and telling signs of a stroke. Let's say you're brushing your teeth or fixing your hair and glance in the mirror. You smile, but something doesn't look right. One side of your mouth doesn't lift like the other. Or maybe you're talking to a loved one and they suddenly ask, "Are you okay? Your face looks a little off." That's not something to brush aside. This kind of muscle weakness or drooping usually happens on one side of the face and can include the eye, cheek, and mouth. You might not even feel it at first, but it's there, and it could be a sign of a medical emergency. Facial drooping is a key part of the FAST test, which is recommended by the American Stroke Association and emergency responders across the country. FAST helps people quickly recognize the signs of stroke and take immediate action. F is for face. Ask the person to smile. Does one side droop? A is for arms. Ask them to raise both arms. Does one arm drift downward? S is for speech. Ask them to repeat a simple sentence. Is it slurred or strange? T is for time. If you see any of these signs, call 911 right away. Why this matters. A stroke can cause weakness in the muscles that control facial expression and speech. This isn't just tiredness or a facial spasm. It's your body alerting you that something's wrong in your brain. What to do? If you notice facial drooping in yourself or someone else, don't wait to see if it improves. Minutes count. Even If the person seems alert or says they feel fine, you need to call emergency services immediately. Don't second-guess yourself. Trust your instincts. A quick response could be the difference between full recovery and a lifelong disability, or even life and death. My friends, these 6 signs are not to be ignored. Stroke doesn't always come with warning. It can strike fast, and every minute matters. The faster you get treatment, the better your chances of surviving and recovering. Let's recap the 6 deadly signs. Sudden numbness or weakness on one side. Sudden confusion or trouble speaking. Sudden trouble seeing. Sudden severe headache. Sudden dizziness or balance issues, 6. Facial drooping or uneven smile. If you or someone near you shows even one of these symptoms, call 911 immediately. Don't drive yourself. Don't wait to see if it gets better.